Hello? You in there? You in there? Hello? Hello? Okay, good, you're there. So, in this video here, we're going to start a discussion on skin cancer, which is still part of the integumentary system, obviously. We're just going to knock some terms out of the way to really set this foundation of what we're going to discuss. So, skin cancer is increasingly becoming more prevalent. I was going to say popular, but that kind of gives a positive kind of connotation to it. Skin cancer is becoming increasingly more prevalent, though, which is a shame. So, more younger folks are getting skin cancer. So, skin cancer, it's no joke. It kind of seems innocuous, but it really can be harmful to an individual, and it can cause a lot of damage. It definitely can. So that's the skin cancer. It's just be aware, be vigilant, and be aware. And hopefully, after we learn about skin cancer, you might be a little bit more aware moving forward for you, a friend, a family member. But some terms. So neoplasm, aka another name for a tumor. So neoplasm or a tumor can be either benign or malignant. We'll start with benign. So benign, it means non-cancerous. So the tumor can continue to grow. It'll continue to grow, which, even though it's non-cancerous, it can cause problems. So if a tumor continues to grow so much, it might push into other parts of the body, which allows them to either over or under function. So it might produce or cause glands to secrete hormones that aren't really meant to be secreted, but due to the pressure they're causing the secretion, or the size of a tumor might get in the way of other organs functioning, so on and so forth. So benign, even though it's non-cancerous, it is something to keep an eye on, a benign neoplasm or a benign tumor, because they can cause complications. And the other form of tumor, other definition of tumor, is malignant. So malignant, they are cancerous tumors, and they do metastasize, which means they spread. So these cancers, these tumors, these are ones you hear about, unfortunately, with people passing away more often, is due to the malignant tumors and malignant neoplasms. And it's usually not the primary cancer that does kill an individual. It's usually the secondary cancer that kills an individual. So where that first cancer spreads to, say it starts in the wherever, in I don't know, in the shoulder, it starts to metastasize or spread to maybe the pancreas, which can cause complications, and so on and so forth. So it's usually the secondary cancer of a malignant tumor that does kill an individual. So some other terms that we should be familiar with are carcinoma. It's cancer associated with epithelial tissue, so this can be skin cancer, liver cancer, kidney cancer, really anywhere with epithelial tissue cancer. If there's cancer there, it's called carcinoma. Sarcoma, on the other hand, is cancer associated with connective tissue or muscle tissue. So if there's cancer of connective tissue or muscle tissue, it's classified as sarcoma. Lymphoma is cancer of the lymphatic system. Pretty straightforward right in the name there. Leukemia is cancer of the blood. I'm sure we're pretty familiar with that one. Leukemia, leukocytes, cancer of the blood. It makes sense when you think about the root of the words here. And then melanoma is cancer of specific melanocytes, which we're going to discuss a little bit farther here in our next episode.